So this video is a list of tips that I actually believe will help you get through dental school. Hi everyone, welcome back to the channel. If you're new here, my name is Raina, I'm a 4th year dental student, and this is a video I've really been wanting to make for a while. I've just finished on my outreach placement for the last 6 weeks, and I've really been thinking about the advice I would give to a younger dental student if they asked me how to get through dental school, and this video is it. These are more general tips across all of the years, but if you want me to make a video specifically tailored towards 1st and 2nd year dental students, then let me know in the comments down below. So just a disclaimer, I haven't actually finished dental school yet, I do have another year left, but I think I've had a fair bit of experience to make this video. Okay, so my first piece of advice from my personal experience would be to start revising around 2 months before exams. Some people might say this is overkill, but for me, I feel like it's just the right amount of time to learn and understand concepts, but not feel like I have to cram and get really stressed. Every single exam I've had so far, I've started revising around 8 weeks before, slowly increasing the amount of hours I'm doing each day as it gets closer. I do want to make an in-depth video later about my exam routine in dental school, but very briefly I'll describe it now. I first start off by making sure I have all of my revision materials together and organised and in one place, and then I write down all of the topics that I want to revise on a piece of paper or a spreadsheet, depending on what I'm feeling that exam season. This helps me to track all of the topics that I need to cover and not miss anything out, but also to spread out my revision. Using this list of topics, I will usually create a rough 8-week revision timetable, first starting off with things that are more complex or things that I don't understand, then working my way to the easier things. I of course use active recall and spaced repetition to learn most of the facts or lists of information, and this is mainly in the form of flashcards that I've made or that I found online, or questions that I found online or been given by the dental school. This is a really effective way of revising because it means you're actually testing your knowledge from memory without looking at anything else, and you're not just sitting there passively reading notes that aren't really going in. I used to use Quizlet back in 1st and 2nd year, and on there you can actually access other people's flashcards, so you can save some time by not having to make your own. With exams, what I would say is pay close attention to what is spoken about more in lectures, what is heavily covered, what's in the learning objectives, and focus your attention around these topics. My next piece of advice is something that I'm really starting to utilise more now, and that is to make an effort to get to know tutors and ask them questions. At dental school, you will have so many incredible dentists and clinicians around you, and they will have so much knowledge and experience that they can share with you that will be really helpful for you in the future. I really got to see this with being on placement for the last few weeks, where I had 3 tutors and they all had their own ways of working, their own knowledge and expertise, and I got to soak it all up and take their advice and apply it to my own work. The tricky thing with dental school and becoming a dentist is that it often can be quite lonely. There's a lot of independent learning, and you have to start coming to conclusions about the way you want to work as you progress through the course, so you have to take all of the expertise from these tutors and clinical guidelines to decide how you want to work. I now know different tutors and different specialties who I would go to for advice about something in their field if I needed to. For example, if I had questions about dentures, I could go to one tutor, or if I had questions about periodontal treatment, I could go to another tutor, but that's because I've taken the time and effort to get to know them and ask them questions and know about their field and expertise. So definitely make an effort to do this as you go through dental school and learn from all the incredible people around you. Okay, my next tip to get through dental school is to make sure you go over your notes before a practical session or a clinical session. This means knowing the steps for the procedure you're going to do, knowing what materials and equipment you need, and knowing why you're doing what you're doing. Obviously, to go through notes, you have to have notes in the first place, so what I would recommend is if you have a lecture or a practical session that goes over a procedure, write it out step by step on a piece of paper or your laptop, and you can take these in with you before the session and look over them as well. Just a side note, if you have your notes on your laptop, make sure you do back them up to something like Google Drive, otherwise that is just a disaster waiting to happen. So doing it on your laptop is fine, but I would say that actually writing out the procedure on paper is probably more helpful for clinics because you can't really get your phone out, whereas you can get a notebook out and check your notes. So basically create this list of procedures, and as you go through dental school, update them and refine them. I've added bits from things that tutors have told me as I've gone along, and it's just so helpful for practical sessions to check things. The clinical time is really the thing that you want to maximise in dental school. You will get through all of the exams and the theory behind things, but when it comes to practical sessions, come prepared so you get the most out of it, because after all, dentistry is a hands-on profession. My next tip would be to always respect and work well in a team with nurses. Dentists literally can't work without a nurse. They are so crucial to absolutely everything we do and the whole dental team, and they make sure that everything runs smoothly. Not only does a nurse help you directly with your treatment by getting everything set up, mixing your materials, passing you instruments, but they also help keep the practice or clinic running as it should. Just to give a few more examples about what kind of things they do, they make sure that you have clean instruments ready and sterilised, that the surgery is stocked and set up, they process radiographs, they type your notes whilst the patient is there and make them feel really comfortable. Nurses will make your life in dentistry 10 times easier, especially when you get on with them, you respect them and their knowledge and profession, because they will know so much more than you in so many areas, so make sure you work with them well. In dental school, usually you get partnered up with someone else in your year and you assist each other, but when you go on outreach, which is placement, you get an actual practice nurse, and it's an incredible experience to work with someone who basically knows what you want before you've even asked for it. It's like they can kind of read your mind, and your appointments get so much more efficient and your patients get better care, which is the ultimate goal. My next piece of advice is to embrace failure in dental school. Now, I don't want to make this point all cliche, and it's probably stuff that you've heard before, but it really does matter in dental school. Dentistry is such a unique profession because it requires you to use your hands in ways that you've never before, and it's a completely new skill. Therefore, you're not going to be good at this when you start, and you'll still be improving each year that goes by. You really have to be open to being not so good at things when you're learning and practicing, because those are the opportunities that you learn the most from your failure. It really doesn't mean that you're bad at dentistry or that you're going to be a bad dentist, it just means that you've tried and given it a go, and next time you'll improve. Failure is something that I initially had a really hard time swallowing, especially in first and second year, because I'd always done quite well at school and had good grades, but dentistry is just so much more than good grades. The practical side of it is a completely different game, and that's where things can get frustrating. Now, I genuinely appreciate the times when things haven't gone as well, because it makes me think differently, and those are the opportunities that I've learned the most and I don't usually forget. Even when I sort of get put on the spot in clinics and maybe questioned on a medical condition, I'm not afraid to say I don't know, because it prompts me to go away and learn about that for next time. Another really important thing for getting through dental school and keeping your sanity is to not overly worry about targets. Over the 5 years, we have a list of procedures that we need to complete and a certain number of each, so for example 40 fillings or 10 root canals, and it can be really easy to get stressed over this number. Targets are important, of course, I'm definitely not saying that they're not. Every dental school needs a way of measuring how many procedures you've done, how competent you are, and making sure you're hitting GDC requirements, but targets are not the be all and end all, and sometimes it's just not in your control what patients you get and what exposure you get on clinics. This past year has been really difficult in terms of clinical experience, and there is just nothing I can do about targets other than making sure I'm utilising every opportunity as best as I can. Even without the pandemic, students often found it difficult to find patients for a particular procedure, and were sometimes allowed to make up these targets in the labs on the phantom heads. Also, to add to this, of course, patients are not targets, they're people, and you can't think of them as numbers. You have to assess everyone you're treating, and whatever they need is just the way that it works out. So don't stress, targets do matter, so use all of your clinical sessions as best as you can, but you can't do much beyond that. You've done your best, and usually you're allowed to do some extra procedures in the lab. The next tip can be a tricky one to initially discover for yourself, and that is to have things other than dentistry to do with your time. Dentistry can really consume more and more of your time. As you go through dental school, you do more clinics and you see more patients. So it's really important to have hobbies or things that you can do on the side that take your mind off it, take your mind off teeth, and give you that time to relax. I honestly think this point is really the secret for getting through dental school. I know if I didn't have YouTube and the gym and other social activities or things that I could do, I would be very stressed and unhappy after a long day of work. We've all heard of the higher than average burnout rates and suicide rates in the field, so I think it's important to know when to take a step back from things and have a good support system around us as well. I really do enjoy dentistry, but I know I wouldn't if this was all I was doing with my time, so it's important to get involved in other things, and you will have enough free time. This is a question I get quite often, so you will have time to join societies, play sports, whatever it is that you want to do. If you enjoyed this video, you might like to watch 5 mistakes I made in dental school by clicking here. Thanks for watching, and I'll see you again in the next one. Bye!